determine the health of your breasts as opposed to determining whether or not there's
you
something,
have cancer.
whether or not you have cancer. Like I like to say this, I'd like to say, you take care of your health. Let your doctor take care of your disease.
Yes.
Because too much of the time, people just say, it's kind of like me when I take my car to the mechanic. I'm not a mechanically inclined person. I'm not really interested. After 2-3 months, I know that I'm supposed to just take my car to the mechanic, let them change the oil and do everything that needs to be done, service it. Let me know that I've done that part. Maybe I need to put petrol in my car once in a while, I check the radiator and all that. But for the most part, my mechanic is supposed to take care of all that. Well, we can't have that attitude towards our bodies and the health of our bodies. We have to be on top of things. We have to be watchful. We have to know what is going on, especially being a black person.
Yes.
So before I take this whole, because that's my issue. I really feel upset when people just tend to ignore or just abdicate and just hand over all responsibility to their doctor, who they see maybe just once in for about 10-15 minutes for once in maybe 2 or 3 months max, and that's it. So let's dive into this. Let's talk about
diagnosis.
Diagnosis, yes.
Because the thermography, the mammography, and the ultrasound will not diagnose the breast cancer. So we need to do a histological diagnosis. And how do we do it? It's been shown that if we can do a needle aspiration of the lump and look at the aspirate, send it to the pathologist to look at the aspirate, it will help than cutting the breast and taking some parts and probably disseminating it. So doctors should look at that, not, cutting the whole lump.
So the usual way in which doctors should do it before would be like, I think the
getting
word was
something.
a wedge biopsy or something.
Wedge biopsy.
Just take a substantial part of tissue and take it to the lab. So what you're saying now is the needle where they use it, just a needle and they
aspirate.
They suck out the part.
Yes.
But they have to get it in the right place. Though.
Yes, they have to.
And then take it for histology and then they examine. And they can determine whether the cells are cancerous or not.
And then they do other tests, see whether the cancer is hormone dependent, estrogen, progesterone, Herceptin positive and negative, because they all have different treatments for it. So we need to make sure that we go to the right place that will tell us all these things.
Okay.
Yeah.
Now, anything with regards to black women, is there any preponderance of hormone?
Not really. So it's almost the same.
Okay.
It's almost the same. Yes, it's almost the same.
Okay.
And there are what they call triple negative. Triple negative is very common among the black.
Okay.
So it's negative to hormone, Herceptin negative, and all that. So estrogen, progesterone is negative, Herceptin is negative.
Is that a bad thing or a good thing?
It's a good thing.
Okay.
Yeah.
Okay.
Because most of the other drugs, especially if you're Herceptin positive, is very, very expensive. Very, very expensive.
I see.
Yes. So it's a good thing if you're triple negative.
Okay.
Yeah.
All right. So other than the fine needle aspiration, is any other conclusive finding, or is that the gold standard?
That's the gold standard,
Okay.
because you need to take it to a pathologist to do a histology and get the whole result. Yes.
Once they've confirmed
Yeah.
that the lady has breast cancer, the next thing is we want to know the stage of the breast cancer. Is it
Yes.
an early stage?
Yes.
Unfortunately, for Nigerians, it tends to be in a later stage. Right? I mean, there are 4 stages. How about
Stage 0.
Stage 0?
Stage 1, 2, 3, 4.
4.
And the stage 1 is when the lump is less than 2 centimeters and hasn't gone anywhere.
Okay.
Stage 2 is about 2 centimeters and probably might have gone to a lymph node.
Okay.
Stage, yes, in the axilla. Stage 3 must have gone to so many lymph nodes. And stage 4 is when it has gone to other parts of the body, the bone, the liver, the occasionally ovaries. No?
Wow. Spread.
Yeah.
And also, of course, when does
To
it
the-
spread to the other breast? Is it stage 4 as well?
Stage 4.
Okay, so
Plus-
when both breasts have breast cancer, it's most likely stage 4.
Yes. Yes.
And of course, we're going to talk about some of the recent therapies and when it is advisable to remove a breast and when it is not and all that.
Yeah.
Okay, so we're still on diagnosis. We've diagnosed, the patient knows she has breast cancer. She probably knew about it. She probably knew she had breast cancer even before she came.
Yes.
But she was just afraid.
Because there's a lot of myths going around, you know. If you do mastectomy, the person dies and all that kind of crap, you know, without knowing, you know, the person that they are telling you about, what she has, whether she has other things, comorbidity of other things.
Yeah.
You know, you just said, oh, after the mastectomy, she died. But, you know,
people just think it's the
mastectomy that killed the person. Another thing is they say you have stage 4.
Yeah.
You shouldn't do a mastectomy.
They
shouldn't, because most times it doesn't heal. And it starts fungating and, you know. So stage 4, you must not do mastectomy in stage 4. And now, I'm just wondering why we cannot be doing what they're doing abroad. Now, people are doing double mastectomy, you know, abroad, so that, because when it goes to the other breast, there's nothing you can do about it, okay? So they do double mastectomy and put an implant.
So the plastic surgeon is right there.
Plastic, yes. So, yeah. Why can't we consider plastic surgeons working with the surgeons and, you know, putting, you know, because the problem with most women, because I'm a woman, when they come to me, they don't want to do mastectomy. They always say, oh, the surgeon, they always want to do mastectomy. That's the first thing they want to do. But they don't know that it's part of the treatment, whether it's radical mastectomy, normal mastectomy, and lymph node. You know, now it's been shown that you don't have to remove all the lymph node, because when you remove all the lymph nodes, they start having edema of the arms, and then a swelling and then, you know, drainage system problem, you know, and then immunity, you know, is not, you know,
it's down. Yeah,
is down. So
we have to take a short break now, but let's go back a little bit. Let's talk about the treatment proper in the next segment as we go.
Yes.
All right. Thanks, folks. We will be right back. Stay tuned.
Thank you.
Hello, everyone. Welcome back. We are continuing our discussion on breast cancer in Nigeria. And with first segment, we talked about diagnosis. Let's go right into, because we don't have much time. Let's go into treatments.
Yeah.
What is the standard approach in treatment, and then what are some of the things that you are finding out can help to make improve results when it comes to breast cancer?
Yeah. The standard approach, orthodox oncologist approach, is first of all surgery. I've noticed that in Nigeria we don't do lumpectomy, which is done quite a lot abroad if the cancer is very small.
Yeah.
We do mastectomy.
Because it's usually a little
late. Yes. So mastectomy, and then we have chemotherapy. We do chemotherapy, and then we had radiotherapy.
Okay. So chemotherapy is primarily they're giving you
injections through the drip,
IV,
and oral sometimes.
Oral as well.
Yeah.
Okay.
And then there's a lot of side effects in it, but it's better than
just letting the cancer
get hold of you.
Take over your body.
Yes. And then radiotherapy, you know.
And then now I believe with radiotherapy now there's more, before they radiate a larger area more focus on,
more targeted in Nigeria, yes. So, and there is a machine they call hypothermia. Which, when you use this machine, the radiation you need to give is so small that it wouldn't cause a lot of side effects. So you do the hypothermia. This hypothermia, what it does is it takes the patient's temperature to about 39.5.
Okay.
Like the patient has fever, is ill. So the body now help, to produce immunity to that infection.
Okay.
So by doing it, and then when you do the radiotherapy, you need to reduce the quantity of radiation you're giving to the patient, and that reduces side effects. But I don't know whether it's been done in Nigeria, but
That was my next question.
yes, yeah. Then we have integrative medicine oncology therapy, which most doctors might say it doesn't work because they are natural substances that are used, and because it's natural substances, no pharmaceutical industry will give them money to do
The research.
with it. So, but why I like this therapy is because the side effects is very minimal, and it works. And the first thing you do for the patient is detox the patient, because it's a lot of toxin that cause the cancer in the first place. So you clean it out before you start therapy. It's like coming to a room that is dirty and you start putting new furnitures. It will look horrible. Yeah. So detoxification, we have a lot of different machines that we use in doing detoxification, clean the patient out. And
by doing that too, I mean, I'm no
improves,
expert,
yeah.
but it also gives the immune system and the patient's body some room to recover and actually fight
the infection themselves.
The cancer themselves, in addition to whatever else, whatever treatment, chemotherapy, whatever you're doing. So I can see how that makes sense.
Yeah. I don't want to call the different names of the machine, but they're available, And what they do mostly is that they increase the immunity of the patient, because the body, God created the body to be self-healing, heal itself, So the immunity increase, it will start healing itself before you start giving all your drugs. So I believe in, and I work with a professor called Professor Ben Fifa, who is a professor of oncology.
Which is cancer treatment.
Cancer treatment. He worked in America before, but because of his mortality rate, he now decided that he doesn't want to do oncology. And he went back to his original place of birth, Switzerland, and he started researching and now started producing drugs called phytotherapy, that is plant-based therapy.
Okay.
And with it, he will, tell you that the patient needs to be treated holistically. Don't treat the disease alone, because the body produces the disease. You need to treat the patient, the nutrition, the water. You need to, tell the patient if you have any higher being you believe in, meditate, spiritual aspects, meditate to it. Because he said, I've seen what that has done for my patients, So I encourage my patient, meditate,
I think traditional or conventional doctors tend to overlook that aspect.
Yeah.
And then the other aspects you mentioned.
Yeah.
And I think that's a mistake.
Yes.
The patient needs to be able to bounce and fight against the cancer as well as it is.
And tell the patient that in the first place, stress contributed to your illness. So try and distress yourself. Teach the patient how to distress themselves, And then diet.
Now, oncologists say diet has nothing to do with it.
Cancer.
I know a few of them.
Cancer loves sugar.
Okay.
And you know that most of our diet is carbohydrate, because people say sugar, they think is the
The
cube.
cubes.
No. But if you eat a lot of yam, pounded yam, and all that kind of thing.
Don't go there. I'm from Ekiti, so please don't talk about that pounded yam at all, man. So pounded yam, tuwo.
All
Right.
the rice, a lot of
Rice.
rice, you cut down on them.
How about meat?
Meat, yes, protein.
Why is meat a problem?
Because the cancer loves protein. You make the cancer grow.
The cancer loves
and
sugar,
dairy,
the cancer loves
and it
protein,
loves dairy
it loves
as
dairy.
well.
Well,
So
so what's left?
there's a lot of things left. When I tell my patient, look, there is a lot of food that we have that,
Okay.
when I give them that diet sheet and say, look at the food you can eat. You don't have to eat those things. You can, instead of dairy, you use coconut milk. And you can use it for your tea. You can use it for your, sorghum pap, So,
We need a list. We need a list of that.
yes.
Of this foods.
Food, yes. I will probably
will
bring it in prostate cancer. Yes.
Okay, we're going to talk about prostate cancer. Okay.
Yeah.
My, time is flying by. The producers are just giving give me the signal again that we're time is up again. My goodness. Okay. So we have one more segment, but we're going to talk about the support aspect.
The support system is very important.
So important. So important. Okay, folks, we will be right back. So don't go away. Welcome back. So we have been talking about breast cancer. We've spoken about diagnosis. We've spoken about treatment. There's a lot more to talk about, really. So, we're going to give Dr. Ijeoma's phone number at the end. So if you want to have more inquiries, to a hospital, so you can have questions. They do a lot of support and treatment in the field of breast cancer,
prostate cancer, colon cancer,
as
the
well.
the first 6, lung cancer, Yeah.
Do we really have much long? Do we have?
Yeah, is for men is the first number 1 killer.
I know that is in the U.S., but
Yeah,
as well.
yeah. Because we use a lot of tobacco as snuff and everything. Yes, and smoking. Yeah. Yeah.
Take a lot of traditional stuff as well, cultural. Anyway, so you need to get more information. But
Yes.
at this point, I think we really have to talk about something that is seriously overlooked. And there's a lot of research that is now beginning to go into it, especially in the field of social support. And just real quick, Doc, there was this research that they did in, I think it was Northwestern America, where they did patients with breast cancer, women with breast cancer, divided them into 2 groups. They gave both of them the regular standard treatment, but one group they gave them, they had them have these discussion groups, support groups where they can talk and discuss their issues with other breast cancer patients and all that. And after 6 months, what do you think the results were?
I'm sure the other people were better.
Much better.
better.
Almost none of them died. I think they lost a few on the other group. But in terms of health and vitality, the group that had the social support did a lot better. And I know, and I've actually attended some of your support meetings at your hospital. So tell us about that and why that's important and how people should take it seriously.
Yeah. I used to have a cancer support group, and they come in. I encourage them to come in with somebody, their husband, their children, anybody. Just come in.
Okay.
And then they talk to each other because, this person might be doing something that is very good that he can share. And we get them to share, their experiences, what worked for them, what helped them, what did not help them, And I noticed that almost 90% of the women with cancer, breast cancer or any cancer, have nobody,
Really?
especially their husband. Some of them will say their husband have moved to another state, or their husband have moved them to their relatives. And some of them, even their children, the children you think will help them read more, research, young children, research, and tell their mother, what they've done, but it was only one man, and there were about 30 patients. Only one man was coming with a wife.
You're kidding.
And the wife had ovarian cancer, and the way this woman recovered, amazing. And we teach them a lot of things. We teach them the ones with edema of their arms. We teach them how to manage it. Then I started teaching them about being intimate with your husband. That you have cancer and you're in remission doesn't mean that you shouldn't go near your wife. It's not a sexually transmitted disease. It is not infective. So, and that support, showing her that she is still lovely, even with one breast, that that you love her just like you did before, and, encouraging her, if she's in pain, you help her, make sure she takes her drugs at the right time, because sometimes they forget to take their drugs, medication, And when they go to their doctors, most times they forget to ask the doctor certain questions. But if somebody is supporting them, like, he can ask the questions. And doctors should be able to answer all questions, if they can. If they can't at that appointment, they should find the answer and tell them later.
They should be able to refer them to other people.
Or get the answer.
So before I forget, Doc,
yes.
I think it's good for us to have your phone number, phone number to the hospital, so people can know where to call. So please go ahead and give it to us again.
Okay. My phone number is 070 88 55 4118 and 08 11111. That's 5 ones 3993. Easy.
That's great. So, and do you have those support groups? Do you still organize the support groups?
Yes, we still organize the support groups, but we've reduced because, you as a doctor, you feel bad when you see patients like that. So before I was doing it every 2 weeks. Okay. Now I'm doing it every month.
Every month. Which day of the month is it?
Last Saturday of the month.
Last Saturday of the month. Okay.
Yes, yeah. Just for 1 hour. Well, it helps. It helps,
I really think people need to take advantage of that and find out more about it. Even if you can't, in Abuja, you need to
anywhere you are,
seek support, seek for help and intimacy. One thing I feel we have to mention before we get cut off again is that pregnant women. What my boss told me when I was trained to be an oncologist myself was that if a black woman has had breast cancer and there's remission, she has been treated, she's safe and sound, she should not get pregnant.
Yes.
Because the cancer would come back with a vengeance. And they don't talk about this among the white people, but among the black people, they've seen that that's an issue.
But among the white people, they talk about it as well, because it's the same hormone that is coming out, from a pregnant woman. Okay. So most of them use surrogate mothers, freeze that, eggs. We don't have that kind of thing here. So people should not try and get pregnant after breast cancer treatment.
All right, folks, there you have it. They've told us our time is up. And Doc, I hope I thank you again. I hope we've been able to touch on these the major parts.
Yeah.
We'll also be talking about prostate cancer in the near future.
Yes.
So again, thank you, folks. Thank you for joining us, and join us next week for another exciting topic of your health in your hands. I'm not sure if we can call it exciting, but see you next week. Thank you.